Funding for this edition of State of Affairs with Steve Adubato has been provided by PSE&G, committed to providing safe, reliable energy now and in the future. The law firm of GIBBONS, P.C., MD Advantage Insurance Company of New Jersey, Wells Fargo, Johnson & Johnson, NJM Insurance Group, Community Food Bank of New Jersey, Fedway Associates, and by ADP, a comprehensive provider of human resources technology and services. Promotional support provided by NJ Advance Media and by Tap Into TV.
I'm Steve Adubato. This is State of Affairs coming to you from the NJEA TV studio in Newark. It is our honor to introduce Dr. Shereef Elnahal, President and CEO of University Hospital. Good to see you.
Thanks for having me, Steve.
The former Commissioner of Health in the state. How different is this job?
It's different, but there's a lot of the same focus on public health issues. One way that it's different is that I'm actually running an organization that has such an important, storied history here in Newark. The hospital really promised tremendous things to the community here. There's a history of displaced communities, broken promises, particularly to the African-American community here in Newark. The hospital was part of that bargain after the Newark Accords to do something about that. And so there's a lot more community work that I do to help fulfill that promise. But I'm also focused on a lot of public health issues that I was focused on as commissioner.
Top two?
I would say the HIV/AIDS epidemic in Newark is top of mind. And also just chronic disease and how much that's affecting residents throughout Newark.
You've also talked a lot about the opioid crisis. You've written about it.
I have.
You said we need to do more. Be more specific.
So hospitals in particular have an important role to play. And my involvement in this started when I was in the state. Governor Murphy really pushed us to do everything we can for the epidemic. And so one of the initiatives was reducing overprescribing of opioids. We took best practices from across the state and tried to scale them. That is a funded program now. University Hospital has its own version of that program called STOMP. Stomp out opioids and treat addiction. So what we're doing is having every single pathway possible for our emergency room physicians to prescribe things besides opioids and connecting our patients to as many alternative treatments for pain as possible. The goal is not only to avoid opioids, but to be successful in treating pain, because if you're not successful, somebody's going to go elsewhere just to get opioids. So we've had some great success with that, 70% reduction over just a few years in opioid prescribing.
Give me another topic that you care deeply about.
I really care about doing a lot more for population health in Newark.
You know, the term population health is thrown around a lot. Define it.
It is going above and beyond outside the traditional walls of the healthcare system to do what you need to do to make patients better. If that means doing things like helping them replace their carpet, which is causing their child to go to the emergency room for asthma, with tile, or if that means taking a homeless person and housing them, that is what population health is about, because the root causes that make people come to the hospital are very far upstream in terms of the difficulties they face in life. And unless we start to address those issues in Newark, we're really not going to make progress for our hospital.
So it's interesting, you know, you have a short-term, medium-term, excuse me, and a long-term plan. Are these the kinds of issues that are at the top of the agenda for you as the leader at university?
Absolutely, and we really have to be thinking in all three time phases. There are a lot of short-term problems that we have to address at University Hospital. I'm optimistic because the staff is from the community. They have the skills, they have the talent, they haven't had supportive leadership at my level to encourage them to do better. So we're talking about improvements in quality, we're talking about improvements financially to sustain the hospital, and we have to make sure we maintain regulatory compliance. I'm focused on those three things.
Where does vaping fit into this?
Unfortunately, hospitals across the state are seeing more and more vaping-related illness. We always knew that vaping was risky, but in recent months and years, there's been the addition of chemicals that are involved in flavoring, and most recently the CDC identified a chemical called vitamin E acetate.
Vitamin E acetate, go ahead.
That seems to be the root cause of so many young people having to go to the emergency room and be admitted to the hospital for severe lung illness from vaping. So we've seen our fair share of people with vaping-related problems, and it's a public health issue that we really need to address head-on.
I'm curious about this. Because you have a clinical background, right? Are you able to talk to your fellow clinicians in a different way?
It helps. I would say it's not necessary to be a leader in public health or in a hospital, but you're able to relate on a different plane, especially with the physicians and the clinicians, the nurses, because of personal experience that I've had seeing patients. So it definitely helps.
Curious about this. University Hospital has a long history. We should also disclose in the past, the university has been a supporter of the programming, health-related programming we're involved in. But curious about this. Because university has been under a microscope for a long time on the state end. By the way, explain the connection between the state and University Hospital.
So University Hospital is something called an instrumentality of the state. It's an instrumentality. It's the only...
No jargon here. Go ahead.
Only kind of thing that's called an instrumentality. We are part of the state, but we are independently responsible for our financial future. So we have to make sure we support the hospital with our operations, the way we treat patients and volume of patients that we see. We do get support from the state, of course, for charity care. We have the highest charity care population.
Explain to folks who don't know what charity care is and why it matters.
And it really matters these days because more and more people actually are losing health insurance in the context of what's happening in Washington. So anyone without health insurance, including Medicaid, can potentially qualify for charity care, where the state ends up subsidizing your care a couple of years later. We have to file those claims with the state, so the state supports.
Because no one can get turned away from the emergency room, correct?
We have a mission at University Hospital that we never turn anybody away, regardless of ability to pay, regardless of documentation status in the United States. We are there for everybody, and that's why we have the largest percentage of patients in the entire state who are charity care patients.
But in that context, where I was going with the bigger picture question is this: how challenging is it for you and your team at university to deal with reputation? Meaning, if someone reads certain media reports, a certain hospital scores a certain way on a particular grading system, and there's so many out there, but the perception is that university is an urban hospital, trauma hospital. I don't want to get into a branding question, but how much of it is not just what you do, but how you present what you do to the larger community?
It's a really important role that I have, Steve. So the different metrics and the different grading systems don't necessarily capture what University Hospital does.
Methodology is a funny thing.
It is. We are the level 1 trauma center for the region.
Explain that.
We take the most severe trauma in the region, and that comes to our hospital. We have the expertise, we have the surgeons, we have the infrastructure to be able to treat the most severe injury, whether it's a car accident or an episode of violence in the city. We are there for the city. We are also the main academic medical center for Rutgers, New Jersey Medical School. And so we have some of the top-notch academic physicians in the entire country doing research and treating patients for complex conditions. So these are the things that are often missed if you just sort of focus on some of the public grading systems that don't necessarily reflect our safety net mission for the community here, but also our academic mission.
I've asked you this before, I'm going to do it again. You chose to go into healthcare, you chose to go into medicine. Because?
I grew up as a diabetic, and I understood what it was like to be a patient going through difficulty. And by the way, I didn't have anywhere near the social determinant problems, the life issues that people face every day.
Social determinants of your health.
Of health, yeah.
Go ahead.
I was fortunate enough to grow up in a suburban community. Both of my parents were physicians, and I still struggled with my diabetes. So what really made me want to go into medicine was my time in Baltimore when I was actually a counselor for newly diagnosed diabetes patients. And it was an inner city environment, and a lot of folks had difficulty. And I started to see that the folks that were impacted the most wasn't from their disease, it was from their social issues at home. So the lack of a home in some cases.
Poverty.
The poverty itself.
Hunger.
And so to not be able to address those issues is a big oversight, which is really what made me want to go not only into medicine, but into public health and healthcare more largely.
Well said. Dr. Shereef Elnahal, President and CEO of University Hospital, right here in Newark, New Jersey, just a few miles from where we're taping. Thank you for joining us, Doctor.
Thank you, Steve.
Got it. I'm Steve Adubato. We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
I'm Steve Adubato. This is the 166th New Jersey Education Association Convention here in Atlantic City. We are joined by Ed Richardson. It says here, past executive director of the NJEA. First of all, Ed, it's great to see you.
You too, Steve.
We've had countless conversations over the years. I disclose this every other time.
Always good ones.
But I'll disclose this as well. The NJEA has been a big supporter, a major underwriter of what we do, and a supporter of NJTV News, our colleagues and partners. That being said, what's it like for you to look back on your, how many years?
26.
Oh, boy. You look back, and what sticks in your mind?
Just that the quality of our public schools in the state has been a constant, and the commitment of our members to the children of the state has been a constant. And so whatever issues have come up over the years, whether it's school funding, student assessment, family involvement, it's always within that context. It's always within that framework. And so, it's so gratifying to be able to step away from the organization at a time when New Jersey's been ranked #1 for the quality of our public schools in the country by Education Week. When we have a level of member engagement and member voice and empowerment within our organization that is virtually unprecedented, or at least in modern times. And that we are focusing on the power of the diversity of our students and our membership in the state.
Why does that matter so much, the last part?
New Jersey's public school students are now a majority children of color. And our educators, our education workforce is not nearly close to that. And so we believe that it's important that as we move forward that children of color see themselves more in their role models, but also that children who look like you and I see role models who don't look like them. And we are very focused on that as a mission at NJEA, and I'm very proud that that is a legacy that I know will continue after I leave.
It's interesting you said that, because this year, social justice, I don't want to say race relations, but in part it's about race. And Cornell West, Dr. Cornell West will be joining us in just a little bit for an in-depth conversation, a major keynote address, right?
Yeah.
No accident that you're heavily into these areas.
Absolutely. You look at the logo for our conference, and it talks about student success.
That's right.
Social justice and education justice.
Education justice.
So we have the #1 schools in the state. We can't honestly say that the quality of education is universal across the state of New Jersey. We also have, even though in the aggregate, the most diverse state, perhaps in the nation, very segregated public schools, very segregated communities. And if we're not helping our children to be comfortable working with people from all different backgrounds, that does not bode well for our society, because as adults, we all have to do that. We all should do that.
But is that the role of the NJEA?
It's the role of public education in one sense. And yes, and NJEA is a huge force for public education in New Jersey. It's no accident that the #1 public schools in the state exist in a state with what I believe is the most powerful education union
So you
in the
correlate
state.
the two.
Absolutely. And if you look across the country at the other high-performing states, they are all strong union states. Why? Because those organizations not only advocate for the people who pay us dues, we advocate for the institution of public education.
You know, Ed, one of the topics, Ed and I have had a lot of on-air and offline conversations about a range of issues, but let's put this out there. You've been with the organization 26 years. You've been involved in a lot of battles, challenges, difficult situations, different administrations, out of the State House. Governor Murphy just actually literally just walked by us before, and I know it's a big deal to have him here at the convention. You've had a good relationship with him.
Very good.
You did not have a particularly good relationship with the previous governor, Christie. As a student of leadership, you and I have talked about this a lot. Do you take anything away from those 8 years and say, you know what, this is a lesson about leadership, about life, negotiations, pick whatever you want to describe, that we learned from that experience? Because it was acrimonious, to say the best.
Yes.
Good, to say the least. I'm sorry.
So, and it's funny that you say that because, you know, looking back on one of the things that I'm proud that we were able to bring forward is we just got approved as a provider for instruction for educators to earn a new teacher leader credential.
I heard about this.
The law that authorized that to take place was passed and signed by Governor Christie. So even in an environment where yes, we're certainly at times acrimonious
on certain
relations.
issues, pension issues, healthcare, so
right.
Go ahead.
You've always got to find where is the common ground, where can we do things where there will be support, because it's the right thing to do, because there's no way you can say that creating a credential for educators to help other educators is a bad thing.
Yeah, why would one be against it?
Exactly. So even in an environment where, no, we never had a good relationship with Governor Christie, I would say we didn't really even have a relationship, but in that environment, you do have to find where can you make progress, where can you find common ground, where could we build relationships within the Department of Education and the State Board of Education, which again, we did during that time. So that's part of leadership, is finding wherever there is common ground, even if it's limited common ground.
Even if people can't see it on the surface. Let me ask you this real quick. I asked Marie Bliston, the president, about this, the president, the standardized test situation. You can give me an update on that, your sense of it, because the NJEA has been very involved in the PARC test. Is that going to exist any longer?
Eventually it won't. Right now, the assessment protocol that's been just recently adopted by the State Board of Education will dramatically kind of scale back the footprint of statewide standardized testing in the state. There is, on the other side of that, a federal requirement that has to be met, so that's been addressed.
With the federal, the National Department of Education?
Yes.
So it's the state and the feds?
It is, yeah. So they're, so the federal requirements are that we administer a standardized test in the elementary grades 3 through 8 and at least once in high school. They do not mandate that those results be used for high-stakes outcomes in any way, either for students or educators. And a lot of research is pointing to the fact that that's a good thing, because let's face it, a student's life cannot be captured on a 40 or a 90-minute assessment. Yes, it's a good measure of kind of where they are. It's a good benchmarking tool. And that's how assessment should be used. It should be a powerful tool in the hands of educators.
Not the tool.
But not the tool.
Ed, listen, I know we'll continue to have conversations about education, about teachers, about students who matter most to them, but I've said this to you before, I'll say it again. Thank you to all the public school educators who have taught our children for so many years. They make a difference every day, and we thank you for joining us.
They sure do.
And having us here every year.
And it has been my pleasure for 26 years to work for them.
Thank you, Ed. Well done. We'll be right back right after this.
To watch more State of Affairs with Steve Adubato, find us online and follow us on social media.
She's back by popular demand. She's Heather Howard, former state commissioner of health in New Jersey and also a lecturer at Princeton University's Woodrow Wilson School of Public and International Affairs. Good to see you, Heather.
Thanks, Steve.
You're the smartest person I know on healthcare, which is a setup for the question. Okay, presidential thing going on. Okay, we don't know what's going to happen. But I do know this, Medicare for All is being talked about a lot. What is it? What the heck does it cost?
Well, numbers as high as it should. So everybody's talking about Medicare for All, which maybe isn't the right question to be talking about.
What is the right question?
I think we ought to be talking about costs, because everybody in America is struggling with healthcare costs. Nobody thinks that we're getting the value we should be for what we're paying for in healthcare.
Okay, so if Elizabeth Warren says, hey, Medicare for All, just tax people who are the wealthiest, will not affect the middle class. When you hear that, is there a party that goes, really?
Well, there's two issues. One, it's, easier said than done, right?
Go
We
ahead.
could talk about.
Or would have been done.
Can you imagine, the concern I have is we haven't thought through the potential disruption, right? It means half of the country has health insurance through their employer.
Yeah, what about if I have my private?
You would be transitioned onto a Medicare plan.
Would I be forced?
Yes, within a number of years, yes.
Is that why some say, how about Medicare for those who want it?
Right, so some people say, well, how about Medicare for all for those who want to buy in? I think it all boils down to, do you think our current system's working and we should just maybe patch it up where it's not, or should we tear it down and start again?
And you say, as an expert on the subject?
Well, I think history has taught us that we get further when we build on what we have and we move incrementally. I don't know that there's a public appetite to throw everything out. And is there going to be a majority in the Senate to do so?
You mean a majority
of people who would support throwing the current system out?
What is the president appears to say, President Trump, as we speak, appears to say, let's throw the whole thing out. Let's throw the Affordable Care Act out. Obamacare, throw it out. Do you think he understands what that would mean?
I don't think he's appreciating how disruptive that would be and how politically disruptive that would be for him. I think he sort of gets it when he says, we'll do it after I'm reelected. Well, what does that say? Then that means, right, I don't want to do anything between now and then, is a recognition that this would cause a lot of people a lot of pain if they have to change what they're doing. Yeah.
So interesting. The whole question of the Affordable Care Act, you and I were talking right before we got on the air. I don't want to confuse things, but part of the reason we do this program is to try to break things down and explain it. And that's why we always love having Heather here, because she can talk in very practical terms. There is a federal healthcare exchange. There is a state healthcare exchange. Consumers, people watching right now, can they go on either one of those? Healthcare.gov, go on, that's the federal site. It wasn't working for a while in the beginning. Now it does. Can you go on either one and sign up for insurance?
Yes, you can go to healthcare.gov. We're in open enrollment now.
Okay.
So
as we do this program in the middle of November, but go ahead.
Yeah, so they can go on healthcare.gov. Now, but you're right, the Affordable Care Act lets states operate their own exchange if they want to. And
why?
Well, because the theory was that states have different perspectives. The healthcare markets are very local.
So let's have more competition? Is that what the argument was?
That California can do it in a way that meets California's needs better, and Governor Murphy thinks that New Jersey can do it differently. And so he, this time next year, will be opening a New Jersey marketplace. He's saying, look, I don't want the federal marketplace. I want New Jersey to own this because I think we can do it better.
Does that make sense?
I think it does, because we're now paying more. Given the size of the state, we're paying the feds more to do it for us. And we can do it better with that money. Keep it here in New Jersey, do more advertising, target it to populations here.
Excuse me for interrupting. By the way, if you're listening on the audio side, Heather Howard, former Commissioner of Health in the state of New Jersey and also a lecturer at Princeton University on these subjects. Fair to say that the federal government cut back on the dollar. You could say advertising. Advertising, particularly for those of us in the media, is a euphemism for public awareness. They're like, listen, we can't do away with the Affordable Care Act, Obamacare. I'm not going to spend a whole lot and let people know about it.
That's right. So you have a president now entrusted with implementing a law he doesn't support.
Yes.
And so some people call it sabotage. He said, I'm not going to fund outreach. I'm not going to advertise the Affordable Care Act. And what's the risk of that? Is that means fewer people are signing up. And it's particularly risky because sick people will sign up for health insurance because they know they need it. But we need healthy people to sign up for health insurance,
Explain to
too.
people why it's not just younger, healthier people, but they happen to usually be healthier. Why do we need healthier people on, and what does that have to do with insurance rates?
Well, because basically, insurance is about spreading risk.
It's a big pool.
That's right. It's about spreading risk, and you want as many people in there sharing the costs so that when somebody gets really sick, there's enough money to pay for those costs. If only sick people buy health insurance, there's not enough money in the system, or you have to charge really high premiums. If a broad swath of people are buying health insurance, and especially healthy people, and arguably not using it, then that means there's enough money in the pool.
So Heather Howard, why is the number of uninsured people in New Jersey rising?
Well, I think partly because there's been this sabotage from the federal level. They said, we're not going to advertise, and that's partly what Governor Murphy's responding to. He's saying, okay, I want to take back control, so we will advertise it. We will let people know when open enrollment is. We will make sure they know what plans are available. And so That's the tension here.
You know, you and I have had this conversation many times, and I'm going to put it this way in the time we have left. If someone says, hey, let's just fix the healthcare problem, you laugh when I say that.
Yeah.
There isn't a fix.
There's not a fix. I like to think in 1948, Harry Truman tried to do universal health care. At that time, health care was 4% of our GDP. Now it's 18%.
4% to 18.
Of our GDP.
Am I wrong that Richard Nixon actually tried to do something?
He did too.
And actually pretty progressive stuff.
Ted Kennedy used to say that one of his biggest regrets was that he didn't cut a deal with Nixon. We could have gotten universal health care with Nixon.
Wow.
And it wasn't good enough at the time, but it would have been better than where we are now.
Then Hillary Clinton, when she was first lady, and then all these iterations.
So finally, Obama makes significant progress, but we're backsliding now and losing ground. And I really think once it's 18% of the GDP, how do you reorganize a fifth of the economy?
I don't know, but we're going to keep asking Heather Howard. Thank you, Heather.
Thanks.
Stay right there. I'm Steve Adubato. This has been State of Affairs. Thanks for watching. I'm out of breath. We'll see you next week.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by PSC&G, the law firm of GIBBONS, P.C., MD Advantage Insurance Company of New Jersey, Wells Fargo, Johnson & Johnson, NJM Insurance Group, Community Food Bank of New Jersey, Fedway Associates, and by ADP. Promotional support provided by NJ Advance Media and by Tap Into TV.
PSE&G is building New Jersey's clean energy future. We're working to protect our network against extreme weather, expanding and upgrading transmission lines, and modernizing our natural gas system by installing new, more durable underground pipes. At PSE&G, our goal is to make sure you have the safe, reliable energy you need to power your life now and into the future.